Halloween, it is next week, and you do not want to be tricked by your kids' treats. So Shamari Jackson, he is with Southwest Behavioral and Health Services. He's here with us this morning with tips on what we need to look for. And if you are a parent, you're going to want to pay close attention to this man because he's got some really important information for us. How did you get started in this kind of work?
So I've been working for Southwest Behavioral Health for about 4 years, and we do substance abuse prevention for youth all around the valley. And we just work with kids, teaching them how to make good decisions and healthy choices.
Yeah, he was sharing with me that he feels so good every day when he leaves because you really are saving lives.
Yeah.
So we appreciate this. This is important because this is what we're going to be seeing in a lot of those little goodie bags that the kids bring home. You have examples on each plate here of candy and then something else. So let's start
Correct.
here. What is this?
Okay, so we're just going to kind of look at some of your common candy and some of your common cabinet medicine. So here we have your regular breath mints and aspirins. And over here we have
so this is which is this one?
This would be the aspirin, this would be the breath mint. As you can see, it's kind of really hard to tell the difference. And here we have a Mentos and an antacid.
Wow, look at that. They're almost exactly the same. A child, and especially a younger child, could easily make that mistake.
Yeah, you don't want them eating too many of those antacids.
No, not at all.
Here we have a regular, one of my favorites, Myconites, and your regular over-the-counter NyQuil.
Right, and again, they just see red, especially if it's a younger child and they're in their parents' medicine cabinets. This is a tricky one, and you...
Okay, this is a tricky one, and I'm going to give you an opportunity to tell me which one is which. So on one side you have the gummy bears, and on the other side is the children's multivitamin. I'm
going to say this one is the gummy bear?
No, that one is the multivitamin.
This is the vitamin. Oh my gosh. I mean, when you're in this moment, right? I need some candy.
Yeah.
They're not going to know the difference. That's a tough one.
Not at all.
All right, how about this one?
And here you have your Tic Tac and Motrin.
All right, I can see that that's the Tic Tac, but a kid may not be able to make that distinction.
They see the orange and they go for the orange. And here's another tricky one. Nobody can really guess the difference. I'll let you tell us which one you think
and
is
this one of them is chocolate, and the other
is the laxative.
I really cannot tell, but I would just say maybe this is the laxative.
No, that one's the chocolate.
This is the chocolate. Yes. I got it. Oh my goodness. It looked a little more dense, so I thought maybe that was the laxative. Okay, so when you see this, I mean, as a parent, I see the similarities. When should we be having this discussion with our younger children? Okay,
so we encourage parents to talk early and often about the risks, the drugs, and the risk and consequences of drugs and alcohol. So it's not uncommon for parents to talk to their kids about healthy choices as early as preschool.
And as our kids age, middle school, high school, how does the dialogue change, and what should we be saying, and what should we be looking for?
Always continue to talk to your kids about drugs and alcohol and those risks and consequences. But when we get into high schools, you know, the seniors, the high school students, they tend to use prescription medication as experimenting and getting high. So we know that this is an issue because, you know, dependence on opioids can lead to more serious addictions like heroin or other things. So we just encourage parents to continue that conversation, continue that dialogue with their kids about the drugs and alcohol.
But start the conversation.
Start the conversation,
Don't ignore
that's key.
Right, and keep those medicine cabinets locked. Thank you so much, great information. It was really tough to tell the difference. We have put a link for more information about the Southwest Behavioral and Health Services information on our website, sonoranliving.com.